Hello, everybody. Welcome to our podcast series, Heart to Heart, brought to you by BIA for You, for Them. These are 5 to 10 minutes of conversations we have with our physician leaders from the community who tell us about a heart condition, one heart condition a month. 5 to 10 minutes for you to hear about the updates and what you should know about it. This month, we're going to be talking with Dr. Nathan Foster about palpitations, about dysautonomias, and also about atrial fibrillation. What's new, what we need to know. Dr. Foster is an electrophysiologist at Ascension Providence Hospital. He specializes in left atrial appendage closure devices, comprehensive atrial fibrillation management, and autonomic dysfunction management. Dr. Foster, what an honor and privilege to have you here today.
Yes, thanks for having me. Very excited.
Thank you. Thank you. Dr. Foster, please tell us a little bit about palpitations. You see a lot of these patients. When is it that we should be concerned about them? When do they indicate something life-threatening?
So palpitations, a lot of patients ask me, what does a palpitation mean? And it's a little bit difficult to define sometimes. I tell patients that the best way to think about it is any sort of awareness of your heartbeats that causes you distress. It could be fast heartbeats, it could be irregular heartbeats, it could be hard heartbeats or a sensation of skipped heartbeats. I've heard them described any number of different ways: flutters, skipped beats, can feel like there's butterfly, or feel like there's something tickling the inside of my heart. I can hear my heart in my ears when I lay a certain way. The vast majority of the time, benign. There are some things to look for, or some things that might prompt more thorough evaluation. Associated other symptoms. When you get your palpitations, do you feel lightheaded? Do you feel dizzy? Do you have chest pain? Do you have other symptoms that go along with shortness of breath? Anything else out of the ordinary that occurs when those palpitations happen? Or is it just the palpitations themselves that are causing you to feel unwell or feel distressed?
So what I understand, Dr. Foster, is that apart from palpitation, focusing on the other associated symptoms that you might have, perhaps always a good idea to get an expert opinion. What about atrial fibrillation management? What are the new advances that we should know about?
So atrial fibrillation has really advanced as a science in general. How we treat atrial fibrillation continues to evolve very rapidly. There was a time where all right, you're in atrial fibrillation. We don't do much about it. Put you on a blood thinner, have a nice day. As technology has progressed and as our ability to assess the consequences of atrial fibrillation has increased, we've become more aggressive about treating AFib. And so traditionally, one of the biggest concerns with AFib is stroke. And so stroke prevention has focused largely on blood thinners. It used to be that we had Coumadin, and that was it. And Coumadin is no fun for doctors and no fun for patients, but it was all that we had. Then came the newer oral anticoagulant medications that really sort of revolutionized that part of the treatment. And the newest advancement on the table as far as stroke prevention goes are the left atrial appendage closure devices. There's currently 2 on the market. There's Watchman, and there's a device called Amulet. Those procedures take about an hour to an hour and a half, offer a very straightforward intervention that allows patients to be protected from stroke without the need for taking that long-term blood thinner.
Thank you, Dr. Foster. I think that was a really good recap on the most latest things to know about atrial fibrillation. And that also brings us to the next question about the smart devices we see all the time now that patients have on, and it will detect atrial fibrillation and they come to you. From what we understand, there is some accuracy associated with it, with some of the devices that has been published in detecting atrial fibrillation. But in your practice, do you see a lot of overdiagnosis and unnecessary anxiety, or do you feel it actually does correlate with hold to monitor and true diagnoses?
I think there's a lot of excellent data that comes from the wearable devices, and they certainly fill a niche that was sort of unoccupied before. So there are external devices that we can offer patients that allow for heart rhythm monitoring, but those are limited to 2 weeks to 6 weeks maximum in a given time. The other option is an implanted loop recorder, which allows for 2 or 3 years of monitoring, but the trade-off is I have to put the thing underneath your skin. It's great data. It works well. So do the external monitors, but there was no in between. And so there's with the wearables that gap is sort of filled. Those patients who need that extra monitoring or desire that extra monitoring can certainly get one of the smartwatches, Apple, Samsung, Garmin, you name it. And the data fidelity is very good. They're accurate. Sometimes you will find patients who get a little bit obsessive about checking their heart rates and checking their heart rhythms. We need to make sure that our patients have good hobbies other than doing so. The technology again is very good. The cost of that technology has come down and has really allowed more patients access to those wearable devices. I think they fill an important niche in cardiology practice right now.
Thank you, Dr. Foster. That makes complete sense. I think the key is to keep in constant touch with your physician and with a medical opinion while you have those smart devices or wearables on. Could you please wrap us up with something to learn about dysautonomia? A lot of young women come to us who have symptoms of palpitations, dizziness, lightheadedness, a lot of incapacitation at workplace, at home. And what is dysautonomia? What do you see in your practice?
So I see a lot of referrals for POTS syndrome. POTS syndrome is usually the diagnosis that is assigned to these folks who have these dysautonomia conditions first and foremost. Myself, I'm pretty regimented about what POTS is. POTS has a certain response to positional changes that has to be met in order to call it POTS. What I see more often than pure POTS is what I call autonomic dysfunction or dysautonomias. And really what happens with these patients is they make their own plate. And I tell patients, it's kind of like going to the buffet. A lot of our patients probably don't remember what the buffet looks like, but they would you go to the buffet and you take a little bit of POTS syndrome, a little bit of inappropriate sinus tachycardia, a little bit of chronic fatigue, a little bit of general orthostatic intolerance, and patients make their own syndrome. They don't make it. They don't typically choose to have it, but that's the analogy that I give folks. So trying to ferret out which of a number of symptoms that cause distress or cause discomfort is the primary driver is sort of the first goal of that meeting is what is the thing that I can fix or I can help make better that is going to increase your quality of life? Because I'm very upfront. I may not be able to make everything go away. I may not be able to make you feel perfect. That's not the goal. The goal is to improve day-to-day functioning. So once you get that defined, you can start to pick and choose a couple of different therapeutic avenues for those patients. And oftentimes just listening and believing that the symptoms are real is enough to put people at ease. Then we can start to develop a treatment plan.
I think that's very well said, Dr. Foster. That kind of adds to the challenge of treating these patients is because the reasons, the etiology is very complex, and also managing them becomes very challenging. And you're absolutely right. A lot of times just for them knowing that these symptoms are coming from this diagnosis helps them tremendously. This was great, Dr. Foster. I learned a lot from Dr. Foster about atrial fibrillation, about smart devices, about dysautonomias. To stay up to date about your health and heart condition, you can go to beayourself.com. You can get a copy of the book, Bia, She is the Force. Again, to request any topics, please email us beayourselfcontact@gmail.com. Thank you, Dr. Foster, for making the time. We will see our audiences next month with another topic. Until then, take care and have a great day. Bye-bye.